All right, we're ready to go. All right, welcome everybody to the January 30th, 2025 meeting of the Eastham Board of Health. This meeting will be video recorded and broadcast over local access channel 8 and through the town website at www.eastham-ma.gov. All right, opening statements. I'm going to go over that way and see if Susan or anybody has any opening
Not right now,
statements.
no.
Hillary?
No, I'm good.
Okay. Hinge?
Me, I always want to.
Okay, Francie.
I'm just wondering if our public health initiatives, how they're going to be impacted by the freezing of the funds.
Do you want me to take that, Suze, or do you?
It's a good question, and we do not yet know. We had one grant application pending with the federal government, and we got word from the FDA that they wouldn't be reviewing it until they had more solid information on if they were still involved in retail food safety programs going down to local health departments. So that's one impact. We're fortunate to live in the Commonwealth where Massachusetts prioritizes public health. So I think we will see some fallout, obviously, but I think most of what we do is pretty well insulated because of where we are.
That makes me feel better. Thank you.
I'm glad.
All right, and I've just to add to that in terms of, I'm going to just do this now and get it done, is I wanted to propose that we do some follow-up to our cesspool information session. Maybe it's a series of workshops to figure out next steps, if any, in terms of addressing cesspools and just making sure we're doing our due diligence in terms of keeping our water bodies safe.
So you want to schedule some workshops?
Yes,
So would you like me to look at the calendar and put some dates out to all of you? In like February, March, April-ish timeframe?
that would be great.
Okay.
Does that work for you?
Please make it on a Monday or Tuesday,
Mondays or Tuesdays.
possible.
Topically, what are we looking for?
We are looking to see, based upon our information session, if there are concrete actions we should or could take to ensure that the existing cesspools are operating safely, and also to examine whether or not we want to explore any kind of regulatory response to the cesspools.
So maybe we'll give you some regulations from other towns to look at.
Yep. That would be great. And just to be clear, we don't know that we're going to have a regulatory response, but I
Right.
don't think we should at least discuss it.
And I think maybe we want to pair the regulation with the map of the locations of the cesspools, because I
Which
think,
we'll have to update. 'Cause
Okay.
there's been changes.
okay,
All right. Does that make sense to everybody? I just want to make sure that we follow up on that session and don't
Yep.
lose that good information that we got. So, okay. Presentation and discussion, Outer Cape Community Services. Come on up.
Hi there. Take a seat.
Thank you.
And I do have a presentation here, so I'm going to join on Zoom and share my screen.
just while you're getting started, this is Alex Nelson. She's
Oh.
been before us before. She came when we talked about Outer Cape Community Solutions and some regionalization work that we were doing with the 4 Outer Cape towns. She's been a major part of our ARPA grant funding, which provided the nurse and the mental health clinician. And she's also been the chief facilitator for our opioid work. So today she's going to present back to you on the opioid plan that we talked about probably close to a year ago now.
Thanks so much. And I do have a couple of slides to talk a little bit about that OC wellness work, if that's okay with you, Hillary. I'm happy to push through it. But so the 4 key topics that I plan to touch on today, first of all, talking about OC wellness, just briefly reminding you of the work that the health departments across the Outer Cape have been up to. Then talking about these funds, giving some background information. Hopefully it's just review, reminders, so I can push through that as well. Then the community engagement piece. Since we've implemented programming, what are we finding? What do we know? And then finally, what's next? So there's a lot of information, a lot of different stories and threads. if there are questions, I hope it's all right. Feel free to just jump in and ask. I think discussion-based is really wonderful. And like I said, I'm going to push through a lot of this, but happy to dive into more detail wherever you'd like. So with that in mind, first, just introducing our organization. So we are Outer Cape Community Solutions. We're a rural health network, and we're a coalition of various partners across the nonprofit sector, municipal sector, working with healthcare agencies, many, many different departments, basically anyone who does work that's related to health and wellness really, really broadly. So currently we do have, or we've received funds from the federal government, state, and local funds as well, in order to try and break down these silos so that folks can work more collaboratively, systemically solving problems rather than just putting more programs out there, really being thoughtful with how we build a structure across the Outer Cape that actually serves all folks in all communities in our community. So that's based in this health equity work that we do as well. A couple of our partners, or several of our partners, are listed here. We have many, many, many dozens more, but just to give you a brief view of who it is that we work with. So again, here's this agenda, talk a little bit about OC Wellness, the funds, and then the community engagement and what's next. So OC Wellness, I'm going to talk about the history, why these partnerships exist, and then some of the current programs. So some important history, as I'm sure you've known over many years, is the health agents in general have been working together for a very, very long time, making sure that they're on the same page about things, whether that's regulatory work or sharing inspectors, just trying to get on the same page and making sure that they feel supported. You know, sitting on these boards, just how much work these health departments do. It's pretty incredible. So they've been leaning on each other for quite some time. It was in 2019 that they really formalized, and since then have become OC Wellness. So that is the formal name of the 4-town collaboration across the health departments. There's a big press release put out. That's how they refer to themselves in any kind of their collaborative work. So what this means for them in this partnership is improving access to healthcare and other critical wellness resources as it relates to public health, creating community and combating social isolation. We've seen that's a growing problem, especially since COVID, and there's data to prove that now too. And then, of course, building bridges across and between the towns so that folks anywhere on this 4-town area feel like they can go anywhere between Eastham and Provincetown and receive support and access resources, really trying to break down those barriers. So that comes through shared services programs that they have together, open communication, working together weekly, being in touch at least, and then of course creating community across town through some of those shared services programs or encouraging, just spreading the word about great programs that are happening across the community. Any questions about the OC Wellness work? Great. So
I have one question.
Sure.
In terms of the network,
yes,
are you working with the Community Development Partnership as well?
we are, yes. Yep. They are not on this list,
They're
but
not on the list, but I just want to make sure.
yeah,
Okay.
so anyone doing health and wellness work, and we have various work groups.
Mhm.
So we have a food access work group working with all of the many food partners, transportation, housing, all these different pieces.
Okay, thank
Yeah,
you.
thanks. Yeah. And happy to come back and talk about OCCS anytime, but that's a whole other big presentation. So in general, too, just want to briefly touch on public health because this is really why we're all here. I think public health is in this really shifting time. And it's the definition is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private, communities, and individuals. That's a pretty beefy definition. So it's really important to me as we dive into this conversation around substance use and substance use disorder and opioids, that we recognize that health is not just what happens in the doctor's office. It really is about all of the other components that impact someone's wellness. So we refer these things as social determinants of health. These are all of the other things outside of that doctor's office. Socioeconomic factors, physical environment, and health behaviors. There's actually science that shows that only 20% of a person's wellness is actually related to the clinical healthcare system. The other 80 is all of that other fun stuff that we were just mentioning. So again, we're really just focusing today on the opioid piece, but just want to paint this picture in this broader context because the work that they do ties into all of this stuff.
I have a question.
Yeah.
When I worked in New York, the hospital system I worked in, they did a whole research program on what happens with, the needy members of the community who come into the emergency room, often recidivism and, where to the homeless population and all the people, all these people with so many problems who clog the healthcare system. How can we best help them? And the NYU hospital system put money into, providing housing. I mean, they did, they actually participated in helping the community with money and for projects to house, to feed, to, everything that people needed, aside from just giving a doctor's care.
Yeah.
And it was a very positive outcome. So I'm wondering if Cape Cod Health, are they all at all involved in this or not?
Yes, and I can talk more specifically about exactly what they're doing, but one of the most consistent ways that they're contributing is through their community benefits program. And that's something that's part of the state. As Hillary had mentioned, we're lucky to live in the Commonwealth for a number of reasons, but Massachusetts has requirements that hospitals have to give back to the community. So in fact, they have a whole grant program where every year they're providing funding for agencies just like OCCS, or to provide programs like mental health platforms that some of the towns are
We
interested
did
in.
apply for one of those grants recently, with the 8 towns on the Lower and Outer Cape to get a online mental health platform called Credible Minds. Our full ask, I think, was around 13,000. They ended up giving us 5,000. I had gotten 8,000 for Eastham alone, so I contributed my 8,000 to the 5,000. So we're still cobbling together the financing to get the program off the ground, but we did receive money from Cape Cod Healthcare for that.
And that's our, most robust hospital healthcare partner for sure. I haven't really mentioned much about the rural aspects of this. The fact that we're a rural health network matters because we know that living in rural communities is more challenging to access resources or to find suitable housing, right? There's just, the infrastructure is not the same and the numbers are not the same in urban environments. So even compared with Hyannis, for instance, they have a lot more resources on the Upper Cape around the hospital. So they're a little more visible on in the Upper Cape area. And to complement that work, we're deeply, deeply lucky to have great partnerships and relationships with Outer Cape Health Services. They're a federally qualified health center, but they do a lot more of that boots on the ground work through their Navigator program or through the therapist or nurse that I'll talk about too. So we've got that hospital, but then we also have a couple of other healthcare components. Does that answer your question?
Yeah. So the Navigator program, I guess you're going to talk about that down the road.
Yes, I will. Yes. Yeah.
I have one question.
Sure.
When you talk about social determinants of health, and it always makes me think of early childhood and adverse incidents in childhood.
Yeah.
Which has a big impact lifelong. But I didn't see many early childhood organizations in your first slide. Do you work with any of those organizations?
We're working with the schools on the Outer Cape. Again, because we're rural, we don't have as many early childhood centers, care centers. We do work with Cape Cod Children's Place very closely, and I'll talk about them a little bit more as well. And because we're working with agencies like Outer Cape Health, they do a lot of work around youth behavioral health as well, and measuring trauma scores, that ACE scores, adverse childhood experiences. So we're working with the partners who are out here.
Maternal health, is that part of that?
Maternal health, we do work with the VNA. They do have a really wonderful postpartum program and maternal health program. So they're certainly visible and working. And through the network, because we hold monthly meetings to bring in more partners, they've been able to engage with the Outer Cape in a more well-rounded way. Certainly they have contracts with the towns, but getting to know other nonprofits through this network has actually connected them to more families. So we are seeing their presence increase out this way tenfold.
Consultant who provides services all over Cape Cod, and she's absolutely lovely. So
Yeah. Thanks for mentioning that. Yeah, she provides services through Cape Cod Children's Place, but she is an independent doula and does really awesome work. If you've seen, I think at Eastham Library, they're holding early childhood sessions for new parents, especially new mothers with kiddos, to go and it's a play group, but really it's a parent support group. So yeah, Becky's doing that in Eastham right now. She's a rock star. Yeah. Great questions. Yeah. I could talk about this for so much longer because this is the rest of the work around OCCS, but I do just want to push on a little bit more. Mentioning what you were talking about related to the ER, right? We recognize that there will always be people in crisis. That's what happens. The idea is that we want to bring people towards a healthier state so that there are fewer instances of crises, right? We know that we need our EMS. We need police intervention for those situations, but the idea is we want to provide as many rafts and resources wherever someone may be along that spectrum of health. So ideally, we can be as proactive as possible, provide them clinics and prevention opportunities, but we still need things like food stamps or emergency financial assistance or access to specialists or having those folks who can come in to your home and help you with whatever you're managing until you can get further back upstream. It's just a quick list of all of the different partners when we think of this wide spectrum of resources. And many of these are just exclusively what lives in towns and in municipal government. We're deeply lucky to be in Massachusetts and on the Outer Cape, where these various agencies and departments are really, really active and deeply embedded in the community and providing critical resources. Just to provide an image too of what this spectrum and what this web really of connectivity it looks like for us. With OC Wellness Collaborative, we have these 4 municipal departments on the Outer Cape taking up that municipal sector. Then we have OCCS, which is connected to a variety of different NGOs and nonprofit partners doing that kind of boots on the ground work. And then also that FQHC Outer Cape Health here with variety of resources, whether it's their urgent care work or their preventive work. These agencies have so many different programs and components that really, through the work that's been building for a decade now, we've created this really beautiful bounty of resources, right? So between Outer Cape Community Solutions, we've got a transportation work group that's working on improving or creating a strategic plan to provide better public transit between the rest of the Cape and the Outer Cape. So we're working on that actively, working with food partners, doing this really intentional work just with our partners. Outer Cape Health has their Navigator program, which is accessible to anyone, regardless of insurance. And then, of course, municipal departments, we know how critical that the libraries are and the health departments are in providing these broader public health services. And through these relationships, now we're all in touch, right? Through the partnership of OCCS and OC Wellness, we were able to get that grant to have this town nurse and town therapist, which with that Navigator provides this real trifecta of support. And OCCS is now also able to refer our agencies and community members to the towns who can make those referrals back to those different agencies. That's just one example of what these relationships that we've been building over several years, some of the impact of that work. So excuse the chaotic arrows, but I hope it just really paints a picture of just how connected we really are and how connected we have to be in an area that's otherwise so isolated and struggles to access various resources. Thinking just about OC Wellness and the work that we've been able to do with some of those partnerships I just mentioned, creating an MOU, a formal agreement between us that says, yep, we're going to work together. We're going to find funding together where we can to work on programs and projects. That included that ARPA award, which Town of Eastham held. That created this town nurse and this licensed mental health clinician, able to have those meetings with various departments across all 4 towns, talking about more collaborative efforts and partnering together and being more thoughtful with our effective and shared programming. And some, of course, critical health and wellness screenings anywhere across the Outer Cape for people, regardless of insurance, which in our area we know is a challenge. We've also expanded Winter Wednesdays. I hope you've been able to see some of that. All of the Outer Cape towns have helped expand that program from Provincetown to provide free social, emotional opportunities for adults to just get together and learn. So really, really beautiful expansion that's going on right now. Having more vaccine clinics available, with which the health departments always do, but working with the Department of Public Health to offer some gift cards and increase enrollment in those things. Having an Ask a Nurse and nutrition program, again, bringing those resources into the area and having people for free able to provide counseling and support. Working with Outer Cape Health to get a medically assisted treatment mobile unit out in Wellfleet for folks who are managing opioid use, which I'll talk about. doing these regional public health surveys. As you know, ECM just wrapped theirs last year, and it has been really, really key because you can't make arguments on grants without having some data and info to back it up. And that is so, so challenging in rural communities where numbers are smaller and response rates are smaller and communication is challenging. So that's been really huge. And then, of course, building partnerships between all of those partners that I have mentioned, whether it's through OCCS and our partners or municipal departments. So why I'm really here today is to focus on the opioid funds. But any other questions about all that other stuff or things you want to add? Yeah.
Two Tdap clinics, we had a small blip of whooping cough cases, and so we worked pretty hard to pull off 2 clinics. It's February 5th from 10 to 12 here at Town Hall, and then at the high school. So it's a regional, both options are regional. We put the word out, you know, far and wide. So we're hoping people come for that.
Huge, yeah. And I was just on a call yesterday with the state talking about the future of funding more clinics. We were originally funded in one of the ways by a rural vaccine equity initiative. How can we increase COVID vaccines in rural communities? And so
That's going to be gone.
that money is wrapping. Yep, that money is wrapping up this year. It was supposed to. But talking about how can Massachusetts, with our current funds and with our internal funds, expand vaccine outreach. So more on that later.
And that's
But, yeah.
for also for infant vaccines.
Yeah,
When you talk about whooping cough, that makes me question how many people are not vaccinating their kids now.
yeah.
Well, we know those numbers. The school nurses know those numbers, and I believe they have reached out to those families during this time to say, we're holding a clinic here at NAUSET High School. Come get your vaccine. It's free.
And we're lucky, you know, that the county, they do offer some public health resources. They have a Vaccines for Children program, which is a state-sponsored program. Those vaccinations happen on the Upper Cape. So we couldn't do this work without the local health departments making sure that these clinics are happening here, because it's really, really hard to get to places like Hyannis, especially if you've got 3 kids under 5 who all need to be vaccinated. So in the future, we'll be talking more and more about how to expand that Vaccines for Children program specifically on the Outer Cape. That's what we were really talking about yesterday.
Can you indulge me going into the weeds a little bit?
Sure.
Are we monitoring the levels of immunization? Because apparently under 85, we lose herd immunity for a lot of these diseases. And, you know, do we have some monitoring of that? Is it possible to do that?
So it's tricky. I mean, we have wholesale monitoring across the population by diseases that come in. We have access to vaccination records if you can recall your name when you got whatever vaccine it was exactly. But we don't have access to your vaccination record, so we can't sort of cross correlate the two.
The state, there's no state vaccine registry.
There is, but we can't, you can only access it for your individual self. So I
Oh,
can't access it for,
For the town.
yeah.
Oh, interesting. Okay.
And I'm in communication, as I know you are, with all kinds of folks about these things. And when there are challenges and when needs arise, like whooping cough, people jump into action, and the state is here and the county is here to provide opportunities. So I think we're filling the gaps when they arise. So yeah, great. Moving along. Focusing now on the opioid funds. Again, hopefully most of this is review, just talking about what the heck this money is, where does it come from, what's the point, how do we use it, and then our plan for how we built some programming around it. Then I'll talk about current programs and then the results that we've been looking into. So these opioid remediation funds arise from the settlements that came from the opioid distributors and manufacturers. If you remember a couple of years ago, these lawsuits were, the bigger lawsuits were settled really to mitigate the unbelievable harm that has been caused by the misinformation through the distribution of opioids. So it's a lot of money that's come into various states. Massachusetts is one of those states that did receive funding. So again, the point of this is to try and undo some of the harm that has been caused through this epidemic. So Funding coming through the state has trickled out through the county. The state itself has some funds that they're spending on their own programs, but they're also giving some to individual municipalities. So that's the money that we're talking about today. So both the state and the county, when these funds started to drop into accounts 2-3 years ago, they came out with some ideas and suggestions for how they would like to see municipalities use these funds. Some of those suggestions included pooling the funds so that you can collaborate with local with partners in local towns, involving people impacted by substance use so that the people who actually have that lived experience do see some results and see some impact from getting these funds. Spending the funds on things that actually do impact those people. So not only getting their input, but really making sure it's impactful. And making sure, of course, all along that you are using evidence-based programs and work when you spend the funds. So what that meant for us in the Outer Cape was that because we already had OC Wellness and these partnerships, it was a really natural opportunity for us to pull together a group of stakeholders between OCCS and OC Wellness to start to think about ways that we could be good stewards of these funds coming into the 4 Outer Cape towns. So since January 2023, we started meeting monthly. We invited a variety of different stakeholders, and some of them were very engaged all the way through. Some gave us input, and that was that. But some of our partners did include OCCS, OC Wellness, AIDS Support Group of Cape Cod and the Islands, First Steps Together, which is a program of Cape Cod Children's Place, Outer Cape Health and all of their great work around recovery services, and then representation from the police departments and EMS groups. There were a couple of other partners who were involved here and there, but those were the really key players who were helping us pull this together. Questions on that? Super. So the areas, again, that the state and the county were encouraging us to look at and really focus on were harm reduction, recovery, treatment, and prevention. So we created these programs, and I believe that was probably the last time I was in front of you having conversations about these programs, sharing what our plans and thoughts were. I don't want to go into details in the same way I did the last time, but just a quick reminder about what those plans are. We kicked those programs off in January of 2024 for an 18-month pilot. So those programs will continue through June 2025 until we have a new plan. And that's why I'm here today to talk about the data that we're seeing as we start to think about what fiscal year 26 could look like for these funds. So in regards to prevention, which is one of those 4 buckets, there's already work that OC Wellness has been doing and will continue to do that we know really, really impacts prevention when it comes to substance use disorder. Some of those things include those Winter Wednesdays classes, having folks gather and have positive social connections. We're also working to have some English classes for people in the community who are learning English. There's not a Spanish-speaking hub that folks can go and find connection in. So having these classes is an opportunity to learn and also bring people together. And then behavioral health supports through that town therapist and working with the VIII and some of their screenings as well. We know that prevention is hard to measure, and I am deeply proud to say that each of those programs are well utilized. Folks are accessing those services, and they continue to be something that the health agents look at together to make sure that it's working and that it's being used. We're offering recovery yoga, both in Eastham and Wellfleet. Provincetown has had a class for a while, so these are free classes, no questions asked. Anyone who identifies as someone who's managing recovery from whatever is welcome to go. Then we also work with Cape Cod Children's Place, their First Steps Together program, which provides peer support to caregivers with children 10 years old and younger. They work with you wherever you are in your recovery journey to help you feel supported as a parent or caregiver while you're on your journey. So we provided them some additional barrier elimination funds to help folks get new clothes for a job interview or just cover any little costs that come up for those folks when they're struggling along their journey. Outer Cape Health has their structured outpatient program. That's otherwise a private program, and they wanted to be able to work with local contractors and practitioners to provide some alternative therapies. So we're providing them some funds to work with acupuncturists or local music therapists, again, to just kind of cushion and provide additional modalities of support for folks in that program. AIDS Support Group has been a huge contractor for us in this work. They've had a mobile unit parked every week on the Outer Cape in all 4 of the towns, so they're in Eastham every single week, providing things like free syringe exchange, Narcan, different information about various resources. No questions asked, come on, they'll support you and help you get connected to any kind of resources that you may need or want.
Is that being utilized well?
We do have numbers that it is being utilized. We're continuing to get the word out. It's winter, so it's tough for folks. It's interesting also that, AIDS Support Group has been in this community for decades and primarily based in Provincetown and Hyannis. Folks used to go to their offices, and especially folks in the Outer Cape would go to Hyannis just based on what they could offer there. The fact that we've been able to have to contract with AIDS Support Group now means that the folks who would otherwise drive to Hyannis once a month on their own behalf and on behalf of all of their friends, going to get supplies for all of them. Now they're here and they're actually able to go and meet their clients in their homes or meet them wherever they need to. So they're making more direct contacts with folks in this community, even though they were seeking services through them previously. Now they're actually making direct contact in a way that they weren't before. So it's really shifting how they've been able to work and support the Outer Cape folks, which is really fascinating. Yeah. Other questions about that? Cool. Something else that I'm really excited about are these nalox boxes. So these are boxes that are meant to look like AEDs. They're on the wall and it is free Narcan. Of course, you can use them in an emergency, but the idea is that anyone who may need or wants some Narcan can have access to it. So they look like that. They're up on the wall. That's an example of one that's in Provincetown, but these are posted all over the Outer Cape, and AIDS Support Group is helping us to make sure those are stocked.
Just add that we have them at the library, the police station, and in the health department.
Thank you. Yeah. More info is available on our website too. You can look at the programs, not only that the funds are supporting, but additional resources that are available in this community for anyone who might be impacted by substance use. So you can head to our website, and our website is also linked on various town websites as well. So just trying to funnel people to a list of resources, because sometimes just knowing where to go is the hardest part. So hopefully that can support folks around that. Before I step into this community engagement piece, I also just want to frame that when we started having conversations back in January of 2023, we had those partners who were doing this work, who have been doing this work, and who have their data and their experiences. And they had been working independently, right? So they had their own data and their own stories and own experiences. But between the lack of rural data in general and the lack of openness around these challenges and resources and programs, as I said, it's hard to know where to go. We just didn't have a ton of information 2 years ago about simply the state of what opioid use or substance use really looks like on the Outer Cape. I'm sure we all have a good idea based on our own experience, but we just didn't have the data. So we recognize that stepping into this work and beginning to build these plans and spend these funds through municipalities would require that we collect this information and we keep moving and shifting and changing as we learned. So just recognizing that this has been a big learning curve for us, and we'll continue to do that as we collect more info about what exactly the landscape looks like for folks in this world. So the community engagement piece, this is what we've been doing over the last several months. We've collected data from those who are participating in the programs. We've also had some in-person opportunities for conversations and data gathering. And then most critically, that private survey, which is what I'm going to dive into a little bit today. About that survey specifically, because it's still open, so tell your friends. This is a survey that's online. It's available online. It is completely anonymous. Really want people to know that, because I recognize that there's a lot of stigma, and we just want folks to know that all we're trying to do is gather more info. So questions are all optional. It is quite a long list, but even if you just wanted to skip it and scroll to the bottom and just tell your story, you can do that. So just getting any kind of perspective or experience from the community in any way that people are comfortable. That's really our goal. It's also available not only online, but in paper version. So it's sitting in the health departments. There's stacks that folks can grab. Folks can call me or any of the health departments and take it over the phone. We're happy to do that and input that information for you. So really trying to break down those barriers to have folks respond to those surveys. It's also available in Spanish. So those are linked through the Outer Cape Community Solutions website, but as I said, also accessible in a variety of different places. The goal is to really look at that data through the end of February. And actually the other day we discussed keeping it open through the end of March, because there's no harm in just getting more info, right? So really looking to get that information.
What about Portuguese? That's
Yeah, thanks for asking. There is not a very large Portuguese population on the Outer Cape. When we look at the demographic data for the Cape, you think, oh my gosh, everyone's speaking Portuguese, right second to English. But as we know, in rural communities, when you actually look at the individual towns, there are very, very few people speaking Portuguese who are living on the Outer Cape. The language behind English on the Outer Cape, Spanish, Haitian Creole, and then Portuguese. So it's not a really major priority for us, especially because we have limited resources. Those are the 4 languages, but Spanish is for us a priority.
Okay.
Yeah, thanks for asking. It comes up a lot, that question. All right, so what do we know so far about the folks who are responding? We do have various overlapping identities. So people who say, yes, I have a family member who had experience using substances and a coworker. That's why those numbers there don't add up to 100, just to be clear. Interestingly, 24% said that they had no exposure in the last year to opioids or anyone using opioids. When it comes to the town representation, it's pretty equitable across the 4 towns because this is a 4-town survey. A couple of things that have come up through this as we've been collecting more info. Folks are asking questions about the difference between opioid programs and substance use programs. So something that we will be working on through the next year is clarifying ourselves. Yes, these are opioid funds. Yes, we do need to prove to the state that we are spending these on programs that support folks who are managing substance use or on opioids. And if those programs also support other drugs because people have polysubstance use, that's okay, right? So we can offer recovery yoga. Do we anticipate that many people in that space are managing alcohol use? Yes, in fact, that's what we're seeing. But because we can say it's supporting opioid use and those managing that, that's how it works with the state. So just being clear about the words that we use when. Anything else you want to add about that? Clarifications? Okay, great. Individuals are totally open to traveling across towns. We've been offering free rides with local cab companies, which is wonderful, and folks are okay with going to Provincetown for a different program. And individuals, frankly, just are really interested in telling their stories. Yes, folks are answering the questions on top, but the paragraphs that we're seeing at the bottom, that's where we're really hearing some important and powerful testimony when it comes to folks who want to share their experience. In general, get to some graphs here. How familiar are folks with the resources? 55% say they're somewhat familiar, pretty good. 20% say not familiar at all. And 25% are very familiar. So certainly work to do, but I was personally surprised to see that 55% at least knew some of these resources that we were talking about. When it comes to the specific programs that we're supporting, you can see the AIDS support group, Outer Cape Health Outpatient. You can read along the bottom those different programs. And we were asking, how familiar are you with these specific programs? So it was really clear that AIDS support group and Outer Cape Health, those are the agencies that come to mind for most people. They're very familiar. First Steps Together, supporting those parents, recovery yoga, and some of the teen programs that we were offering early on, not as well known. So good, important information for us. And that free Narcan that we're providing, along with some free trainings that we've coordinated through Chambers of Commerce with the support of the health departments. Some folks know about those, but more work to be done when it comes to spreading the word. This graph is always a head scratcher to me because the idea was, when you look at this list of things, what really sticks out to you is very, very critical as community members that we address. So how important are each of these services and programs? It's a lot of blue. A lot of people said these are all very, very important. Just to really parse it out, the number one, enhancing treatment access for people who use opioids and expanding accessible counseling and support services. So those were number one. Second to prevention and education, or second is prevention and education. Third, free activities for those in recovery or managing use. Free community spaces, harm reduction programs, and support groups for those with loved ones who are using. This is where I'm really focused on for us in our next work and our work here in the future is this challenges to just accessing care. We got some really, really key information here. So number one, consistently, folks said the biggest challenge to accessing resources and care, stigma. This related to feeling like they couldn't talk to other people and even ask where to go, or they couldn't be out with the fact that they were struggling. Related to that were some of these other broader systemic challenges of housing, transportation, and finances. So these are the things that partners in OCCS are working to address. The housing, working with CDP, right, or transportation, our work group, or finances, providing barrier elimination funds. So we're doing things, but these are the big, messy, complex things that are really, really challenging to address. So no real surprise that those are the biggest challenges. The other challenging components that came up, just access to programs and the lack of resources. In rural communities, there's just not as many programs. This was our first real foray into bringing programs here and putting it out there in a front of mind kind of capacity, but continues to be a challenge for folks. What we found was most accessible. Folks said, got that, I know about it. Harm reduction and peer support, which is really, really excellent because harm reduction work, we know if folks are still choosing to or still engaging in substances, they can access harm reduction supplies so that when they are ready to take that step towards recovery or treatment, they're connected to those other agencies who can make those warm handoffs, which is important and validating. And then also peer supports related to stigma. That makes a lot of sense, right? People want to talk to other people who are managing these challenges themselves. You want to talk to someone who gets it and understands. So many of the agencies that we work with have these peer recovery coaches or peer supports built in, and folks know about that, which is great. So I just have this tree here to demonstrate that it makes sense that the more programmatic pieces, like free syringes or free coaches, those are well known, those are those programs, but it's those broader, more complex pieces that are the real roots of these issues that continue to ensnare people in these challenges.
I just want to interrupt to
Yeah.
make sure I'm understanding this. So these are from the surveys, right?
Yes.
And how many people responded to the surveys? Because I'm just trying to think of like
Yeah.
the self-selection bias. That's where my head is going.
Yep.
So
Yeah. So this data, like you said, is exclusively from the survey. We've also collected input from in-person survey or in-person conversations as well. So that is not represented in the data that you see, but that is represented in this specific image. Those conversations were consistently about stigma. Say again?
do you have focus groups or?
That was our attempt at focus groups, yeah, to have these kind of community forums to bring people in. We have more opportunities and things planned, but we do have fewer than 36 responses on that survey. So that's also why I'm here today, to try and increase response rates.
Okay, thank you.
So yeah,
So just a suggestion, if you do it again, we have all those big blue bars. You might change the question and have them rank order.
Yeah,
great.
yeah.
Yeah,
That's a
that
good
would be
idea.
helpful, right? Thank you.
Of the following, rank these in
Yeah.
that level of importance, because then you'll
Then
get
we
the
have an
information you
idea.
want.
Yeah, exactly. Yeah. So the key takeaways that we've seen, whether this is the survey or those conversations, or also from our partners and the information that they're sharing from conversations that they're having out here, which again is not represented in the surveys, but we're continuing to meet monthly and hearing these things. So big takeaways. No major surprises in what we're seeing. A lot of this is just exemplifying the fact that there have been few resources or few conversations about these kinds of things. So we know there's more work to do, and we're along that path. Similarly, that wide net approach of having a wide array of different programs to check each of those different boxes and support different populations, that is working because the needs are broad. Peer support and that harm reduction work that we're supporting, those are accessible, those are working. People know about those, and it's something that folks are engaging with, which is excellent. Those systemic issues that I mentioned, those red bars, huge in this work, specifically around substance use. Similarly, that stigma challenge, that is one of those deeply underlying challenges, and it's really preventing people from even beginning to ask questions about where they could go if and when they want to start addressing their challenges. And in general, just needing more feedback, collecting more data. Yeah.
One other thought, I don't
Yeah,
know, maybe
please.
you've already done this, is in terms of the data, are you also collecting data from Cape Cod Hospital or Outer Cape? Just diagnoses, UDS data, the FQHC data on, so you kind of have a baseline in terms of by diagnoses?
Yeah, thank you. So Cape Cod Healthcare does part of their community benefits work is doing this big assessment every year. We do have that data. It's wonderful. And because they're based in the Upper Cape, because it's not based out this way, it does not properly paint the picture of what the challenges really
People here
are.
aren't going to the hospital there. Or maybe Outer Cape is a better source of that kind of data because
Yes.
people are going to go to the clinic with whatever diagnosis. However, I'm sure they have to report that to
Yes.
HRSA, right?
So when it comes to personal health data, that's not anything that we have access to related to the hospital. That needs assessment. Those are voluntary responses that they're collecting. And then it's demographic data. There's a couple of things that they include related to Cape Cod Healthcare patient information, but it's very, very broad. That's not
Outer
something.
Cape.
Outer Cape Health, we don't have that directly. Similarly, we don't have that list of patient challenges. That's not information that they share publicly. But we do work with their Navigator program really closely, and they have that data. So it's informal that we have that info.
Go ahead.
I think that when we started talking about this, I brought up the issue of etiology of substance abuse in terms of pain, self-medicating for pain management or medicating for pain management after pain meds are cut off. And I think that if you're talking about the next phase of this, you may want to find out how many people have come into substance use problems through having some sort of an injury or pain condition. Because it really bifurcates the approach that you can take. It also decreases stigma for people who can think that they've come to that because they had an injury. So you get a lot of more honest responses because people feel like they have a rationale that's not as stigmatizing. So as you talk about that, it's a way of involving the traditional mental health, traditional health system a little bit more to maybe consider doing some pain management workshops or seminars as a way of dealing with the upstream causes of substance use around this area.
Yeah, thank you, certainly. And I can say that just in some of the responses that we received, that is a story that's come up a number of times for people wanting to tell that story of trusting doctors and having that not work in the way that they thought. So I appreciate that perspective and highlighting that. Yeah. Thinking again about the data, it's really, really challenging to work within healthcare systems because so much of that information is deeply, deeply guarded by HIPAA. So it's something that we continue to work on with them, not just related to substance use disorder, but all kinds of other challenges. So it's something that we're working on them with actively, whether it's through their Navigator program or working with their Test and Treat program, just trying to get some facts and information. We recognize that they do serve a huge population, and there are many, many people who simply don't seek primary care, don't have primary care. So that's another component of this, and that's many of those folks are engaged with our Health and Human Services partners. So sharing data is an ongoing conversation and challenge, but I appreciate your bringing it up.
Do you have any idea in your population about the age ranges of people who are coming for help?
Demographically, we based on some of that data that I was saying is really challenging to get. We know from some of that more health system data that the numbers of older adults who are actively using or who are struggling with substance use disorder is rather high. It's many, many older adults who are struggling with this. When it comes to folks who are accessing resources and engaging with harm reduction supports, they do see younger populations, but I think even early on, I was really struck by some anecdotes from AIDS support groups saying that they were seeing many, many older adults, particularly from the Outer Cape, who are accessing their services. Yeah.
I also want to temper my suggestion by saying that I'm very impressed with what you're doing and all of the work and the range of the work that you're doing. So Thank you for the good work.
Thank you. It's complex, really. That's what these conversations, that's what this brings to mind for me is there's just so many moving parts and pieces, and there's so many players, which is a good thing. We've got all of these resources and lots of people with their boots on the ground, and the coordination and the info sharing that's the real work. So thank you.
And I just want to say something like going forward, there may be needs for some kind of workarounds, and I'll just leave it at that, because I think there's going to be challenges to the work you're doing. From-
Yes.
And I think that, I mean, I think all of us sitting in this room would be, we would be willing helpers in that.
Thank you. I appreciate that. And again, that's a whole other conversation, but I was on a call yesterday with the Department of Public Health, the State Office of Rural Health. We've got some real champions at the state level, particularly those who know about the work on the Outer Cape. I meet with them monthly. The health agents have been meeting with my connections, not to mention the various connections that they have, but there's a real understanding at the state level of the depth and the strength of the work that's been happening around the Outer Cape, largely based around the collaborations, because supporting rural communities is deeply, deeply challenging, and they've been really, frankly, impressed, and have been reminding us of that for a while, which is really, really wonderful. So we continue to face challenges, and I know we're well supported. So, yeah. Just want to say our final moves, we're going to continue to do these community engagement components, build these plans for fiscal year 26, which start July 1, 2025. And of course, as I've already mentioned, our big focus will be on addressing that stigma and working with some specialists who work in rural communities to address stigma. So I've already had some conversations about how to move the needle in small towns like ours. So thanks so much. These QR codes are available in your packet with the survey, and not to mention all of those various resources that I was hinting at as well. So that's available on our website. So thank you for your time.
Thank you.
That was a beefy presentation, but I appreciate your engagement.
Well, thank you. And yes, I want to echo Elena, just like the questions and suggestions are because we're engaged and we're interested and we're excited. So please accept those as that.
Thank you. So it's always the most fun coming to Eastham for that reason. Something about your boards here. You're in it. I love it.
I love this stuff. No, good
We're
job.
big on
Thank you.
public health. In this,
Huge. It's huge. And like I said, the Outer Cape in general gets a lot of it.
I mean, we're big on
Definitely.
water and sanitation too, but
There's some other fun stuff mixed in there. I know that. Wonderful. Thank you so much for having me here today.
Thank you.
Scoop back here.
See you tomorrow. Right. Next on the agenda is 245 NAUSET Light Beach Road. Welcome.
Good afternoon. For the record, I'm Laura Schofield from Schofield Brothers. And I'm here representing Chris and Deanna Carter at their 245 NAUSET Light Beach Road property. And is it possible to get the plan up there? I have not. Okay, it's coming. It's coming. So this project was actually reviewed and approved by the board in August because the septic system incorporates an innovative alternative technology. And we're here today because the soil absorption system was slightly redesigned. So we're just here for the board to re-review the plan and ideally reapprove it. And just to refresh everyone's memory, this property is located north of the lighthouse and it overlooks the beach. And currently there is an existing 3-bedroom property on the dwelling that is getting pretty close to the top of the coastal bank. And the Carters would like to rebuild a smaller 1-bedroom new house at the far back of the property. But before they can do that, all the new permits the permits have to be in place for the new house before we can take down the house that's on the edge of the bank. And since we were before the board to review the septic system to serve the new house, we have been to conservation and received their approval. And the project has been before the zoning board of appeals for their approval. While it was before the zoning board, they asked if the location of the new house could be slightly shifted to the north by like 5 feet or something like that, which we could do,
Because
but
of why? I'm sorry. Oh, you don't know.
they just asked if it could be shifted off of the southerly property line by a few feet. But originally, I think it had a 5-foot separation on the southerly side of the house, and they asked if it could just be pushed to the north a little bit. And originally, I had used a galley design, which tends to be a little bit wider. And to accommodate the house moving to the north, I just substituted that with a long, skinny soil absorption system. Both of them comply with Title V. Both of them don't require any variances or local upgrade approvals. And we just redesigned the system to accommodate the wishes of the zoning board. So that's why we're here. And yeah, that's pretty much it. It's pretty simple today, happily. So, and I'm happy to answer any questions that the board might have. The new soil absorption system is a Caltech trench. And
That was interesting to me. That is protective against vehicles going over it. Yeah.
Caltech, those units that they have, the 180 HD units, they're all rated to be driven over. So they don't even make one that can't be driven on. So, which is good.
Yeah. So nothing will break.
Yeah. Any other questions?
I have no other question. I'll make a motion to approve the project as presented.
Yeah,
Or
just,
does
yeah, I was gonna make sure, do you guys have any
No, we're fine.
input? Okay, just want to make sure before we move forward. So, and so no variances, no other changes.
Nope, it's just here for your review because it has a innovative alternative technology being adjacent to the beach. It's an environmentally sensitive lot and
Yep.
requires the IA, which it has.
You already approved it in August, but because Laura had to make changes to the already approved plan, she had to come back to you for this.
So,
Everything else is the same except for the.
Can we just approve it
of this.
as we did previously? Or
Yeah, all those,
we already approved these.
those are all the
Points.
same as what you approved last time.
So can I make a motion to approve the project with the new soil absorption system as presented?
Second.
all in favor?
Aye.
Aye.
Thank you.
So that was, yeah, it was simple, thank you.
Thank you. That's
we need your plan.
my plan.
Your plan goes to Laura.
My plan. It's
okay.
I scotch taped it.
Am I signing this one?
Yes, please.
Okay.
Yours?
This one's here.
How are you?
Right.
Sorry.
Thank you. Thank you very much.
Thank you. All right, the next item is 5 Kelly's Path. Anybody here for that? It's a reduction request. All right, so this is a request to reduce the frequency of effluent sampling from 4 times a year to 2 times a year based upon sampling results over the past few years, which, the exception of one result, all look to be under the threshold in terms of nitrate. Any discussion on this one?
My
Comment?
only question is their contract is good through this year, and then what do?
Most of them are an automatic
Renewal?
renewal now.
Okay.
I just had a question. Most of the times we see a high value, it's during the summer in August, and this one's in January. Is
Think
it possibly an
because
aberrant?
It's not getting used enough in those winter months, and that's why
Oh,
it
okay.
needs to be fed. The system needs to be given
Mhm.
something to treat. So if they're not here and not using the system, I thought that was interesting too, though.
Thank you. Yeah.
So it's twofold. If it's getting too much, it's not working right. If it's not getting enough, it's not working
It's
right.
always a
Oh,
ratio
right.
of extremes, right?
Balance. So
Yeah, it's only, it's like right at the,
Yeah, right.
at the threshold, yeah.
okay.
Okay, let's
It's
con-
also interesting how the numbers came down after it went into use. That was like a huge, from the day one to like the next
Yep,
reading.
almost right away.
Yep.
Interesting. Anyway, should we make a motion to approve the reduction request?
Yes, we would, yeah, I'll do it. We make a motion to approve the reduction request with the following conditions. Effluent sampling to be conducted 2 times a year in May and September. Effluent sample results are to be uploaded to the Barnstable County Department of Health and Environment, IA database, or forwarded to the Eastham Health Department if not available. The property owner is to maintain, to your point, an operation and maintenance contract for the life of the system.
A second.
All in favor?
Aye.
Aye. All right. Minutes.
I just have one question, Hillary, was there any update on the rabid raccoon?
The rabid raccoon came from the New York, Pennsylvania border. No one ever turned themselves in to say that they picked it up and moved it.
Oh, my God.
How did they figure that out?
They sent the sample off to a lab, and the lab looked at the DNA of the animal and they compare it with other species around the country, and that's where it was the closest match to.
Oh, that's
Somebody
cool.
actually transported this poor creature and dumped
Well,
it here?
someone definitely managed it at some point because it was shot and it had a towel over it, so.
Oh, my God.
So yes,
So we don't know if
Interesting.
any other
Another rural
wildlife came
mystery.
in contact with it while it was
no,
lying
we
there?
had no idea, no
No
one ever
idea.
came forward.
Wow.
Right, well, that
What?
rabies vaccine
Yeah.
that my dog got yesterday was,
Oh, that's another good update.
what?
The rabies clinic has been scheduled and information will be going out soon.
What
It's
is
on the
that?
website.
It's on the
The
website.
rabies clinic.
April 13th at the Eastham Vet.
Well, they're having a
It'll be in your
rabies-
packet next month.
Okay.
All right, any other comments on the minutes?
I have none.
So then I would guess we make a motion to accept the minutes as presented. All in favor?
Aye.
Good job, Sam. Other business, I actually want to raise one other question just because I forgot to in the beginning, but, bird flu. So I just saw something come out from the state. Will the town be doing anything in terms of public and education, or does that just come from the state? And I'm asking as someone who walks on the beaches and sees dead birds all the time and thinking,
do?
yeah, just go to First Encounter. But, you know, just quite seriously, no, I mean, there's so many dead birds there. I don't know why it's, yeah,
Wow.
yeah. But you know, for humans, for their pets, in general, from what I saw, the guidance is stay away.
Yeah. I know Stephanie, the animal control officer, has picked up a number of birds and sent them off for testing. We could certainly work with her to get some public information out.
Appropriate. I don't want
Well, I
to raise
think-
alarms if
I think
inappropriate.
It is appropriate. I mean, there was a large quantity of birds found in the Plymouth area, so it's,
It is on.
Oh, okay.
so yes, we'll get some educational materials out there.
I mean, would it ever come down to like posting a sign?
Yeah, I don't think we're there yet. We're not there yet.
Have there been any cases in Massachusetts? I haven't heard of it.
No, I don't believe there has been a case in Massachusetts. I know we've had some in the United States.
Those are mostly poultry workers, though.
Yes, exactly.
Well, no, I've read, I think we've all read that they have found
Oh, this is-
avian flu in wild birds, but I don't know if
Yes.
it's here.
Yes, we have it here. Yes, some of the birds that we've sent off for testing have tested positive. But, you know, our birds don't stay just in Eastham. They travel.
Mine stay.
You might have special birds.
To stop feeding them.
Yes. Can't do that.
Well, anyway, I
Yeah, we'll
heard the
get something
state
out.
announcement and it made me think this for public health
Mhm.
would be appropriate. So,
So in your packets, you have, information on proposed zoning amendments from Paul Lag, our Community Development Director. If you wanted to review those and then get any questions or comments onto Hope, and then Hope would direct those over to Paul. Given that we had, something else on the agenda with Alex today. We weren't able to get Paul in on this, and he needed to get the information out to you so that he could get it pushed forward where he needs it to go. So any questions or comments regarding what is in your packets from Paul, forward to Hope, and then Hope will forward it to Paul.
and is there a timeline? Should it be in the next week, 2 weeks?
I believe he was going to the commission next month.
It was
It
time
was
sensitive.
Yeah, I would say I could get back to you, Hope, on that.
Okay, I just want to make sure that if
Mhm.
people take the time, we do it in
Yeah.
a timely manner, so it's useful.
Absolutely.
Okay.
Okay. Thank you.
All right, any other business? Can I mention, I'm looking at Clay's name, I know, before we adjourn. I think it's okay to say that Clay has decided that he has too much on his plate in terms of work and school, so he will not be participating as a board member, going forward. So we just need to, explore options for new board members.
Yep, I have sent an email to Kate Paradise yesterday, asking what the status on that it was.
Okay, but just so everybody knows publicly that Clay has decided that to step away at this time.
Mhm.
He's got other things on his plate. So. All right, anything else? No, would you like to come up? Yeah, we do.
Well, so you wonder why I'm here. but I just
If you'd like to say something, please just identify yourself for the Zoom.
I'm Deanna, and I'm on the zoning task force.
Oh,
So I saw that it was on the agenda today for you to review it, and I didn't realize that you weren't gonna review it.
oh.
But I've learned a lot since.
Oh,
So I'm really happy that I came.
Oh.
Although the business about the dead raccoon from New York, it just, yeah. Too much, yeah. But anyway, thanks for asking.
All right, well, thank you for coming. Yeah.